Welcome back to the Microlearning Credential on Effective Healthcare Waste Management. This is Module 2 of the course. In this module, we will study the different classifications of healthcare waste, as well as understand some common healthcare waste generated at a health facility. Let us begin with the basic classification of healthcare waste. As Safia started learning about waste management in her hospital, the first question that came to her mind was how to classify different healthcare wastes, since the hospital generates different kinds of waste on a daily basis. Let's understand what Safia learned. Healthcare waste refers to all kinds of waste that are related to medical procedures and are generated within healthcare facilities, clinics, research centers, laboratories, and pharmacies. With the constantly growing healthcare sector, the amount of medical waste is also increasing, which implies increase in potential health risks. The quantity of medical waste produced in a typical developing country may range from 0.5 to 2.5 kilograms per bed per day. For example, India generates as much as 500 tons of medical waste every day. Therefore, it is important to understand healthcare wastes and different effective protocols for the proper disposal. Healthcare waste is divided into two basic categories: hazardous waste and non-hazardous waste. Non-hazardous wastes are the majority of the overall amount produced, accounting for 85% of the total. The remaining 15% is hazardous waste. The type of medical waste generated mostly depends on the site of waste generation, whether it's a clinic, lab, blood bank, research lab, hospital, etc. It also depends on the specific activities performed there. What is non-hazardous waste? According to WHO, non-hazardous or general wastes are wastes that do not pose any particular biological, chemical, radioactive or physical hazard. This is because such kind of waste is devoid of sharp materials, hazardous and radioactive substances. It primarily comes from healthcare facilities' administrative, cooking, and cleaning departments. This waste can be disposed of following similar procedures applied to municipal solid waste, such as solid waste open burning, solid waste sanitary landfills, incineration, etc. A few examples of non-hazardous wastes are food waste, hygiene waste, domestic waste, packaging waste, recyclates like paper, aluminium, glass, etc. What is hazardous waste? Hazardous wastes, on the other hand, are wastes that are associated with some potential health risks. These types of wastes require appropriate techniques for disposal. These types of waste primarily come from clinical practices. One or more of the following qualities may contribute to the hazardous nature of healthcare waste. It contains infectious agents. It is genotoxic. It contains toxic or hazardous chemicals or pharmaceuticals. It is radioactive. It contains sharps. Some examples of hazardous wastes are syringes, blood or body fluid, contaminated surgical instruments, delivery bowls, used gauzes and gloves, plasters, etc. Hazardous wastes are further divided into several categories, which we'll study in the next lesson. The next day Safia went to the hospital and realized that it produces both hazardous and non-hazardous waste on a daily basis.